Hey everyone, and welcome back to part 2 of our SOSORT vlog. In part 1, we covered the pre-conference and the first day of the SOSORT conference. So this is going to cover days 2 and 3 of the conference where things got even more interesting. We'll be talking about some of the standout awards presentations, including one from a surgeon here in the US that showed that Schroth therapy and bracing actually help to reduce the chance of surgery for many teens in his care. We'll also be sharing more about what we learned and some behind the scenes moments of us hanging out around Italy. If you haven't watched part 1 yet, make sure you go back and watch that first. Let's jump into part 2. This is the awards papers, which are the ones that are the most highly ranked of the research that's submitted to the conference. So some really cool information here that I want to share with you all. And then a fantastic speech from the president-elect of the SRS, which is our sibling association where the surgeons shared their research. So a few things, a trial looking at scoliosis-specific exercises. This one I specifically was Schroth, and the results in the muscles, the paraspinal muscles specifically. And many of you report to me that's where you have your pain and your issues. So this is important. Listen in. Scoliosis-specific exercises can actually help to reduce the asymmetry of tone in the paraspinal muscles. So what is tone? Tone is like how turned on the muscle is. So many of you experience tightness or soreness on the convexity of your curve. That is the tone. So this looked at a 12-week program that they were able to improve the tone balance of the muscles. It actually didn't make a big difference in terms of muscle activation and the oxygen recovery, which I think it's a measure of how strong the muscle is, but this was only a 12-week study. So as you know, and as I told many of our clients in coaching, takes probably more than 12 weeks to really see those big changes in muscle mass. Where we see in the initial 12 weeks is actually probably postural. And this study mentioned too that actually a lot of the improvements with scoliosis specific exercise are coming from the postural changes and the postural improvements initially. And this is exactly how we build our online coaching programs. The initial 3 months are really focused on the postural improvements and working on the asymmetry of the curve. And then we move more into the strength training piece of things. There was a study on AI trying to predict progression of scoliosis curves in teenagers. Very interesting study, but not a strong enough model yet to be able to make those predictions. So coming soon. There was a meta-analysis, which is a big study of a bunch of little studies that showed actually scoliosis exercises and core training to be effective to help with scoliosis. The problem with these type of studies is the research is very heterogeneous, meaning that the studies that they combine to make this big study are not always exactly the same. So it's hard to make really big conclusions here, but it does show us that Schroth exercise and core exercises are very helpful initially, but then Schroth exercises beat out core exercises as we go on later in care to be more effective. So I think that having an individualized approach is very important with scoliosis. And that speaks to the last piece of this meeting today, which was the lecture from the SRS president-elect. And he spoke a lot about indications and contraindications for scoliosis surgeries in adults. His lecture was completely on adults, which I love to see more research on adults coming out. This new paper by the SRS was a big study of adults in Europe. What they found was that you can have spine corrective surgery for scoliosis at any age, but the complication risk increases when you get over 50 years old. So this is an important thing to think about if you are considering a spinal fusion surgery. That doesn't mean just automatically have a surgery when you're young, just to say like, oh, I don't want to have it when I'm older. What this is saying is that you can have surgery at any time, but this needs to be a decision between you, your surgeon, and to understand that this is a decision that may come with varying outcomes. And we see this a lot with clients. We have some clients who have amazing results after spinal fusion surgery. We have clients that have some new challenges after spinal fusion surgery. So I think it's important that we have this research to really give an accurate, based on evidence, idea of what can happen with having a spinal fusion surgery. So that's a quick recap of the big important talking points today. There were some other studies about analyzing scoliosis curves, measurement, things like that. I can talk more about that on other vlogs, but for the sake of what you all want to learn, I think these were the big takeaways. So feel free to send us any questions in the comments, and I'll see you with our next recap. We have made our way to Milan, but I wanted to give you a little recap of the official conference, day 3, really just a half day. So there weren't a ton of presentations, but there were some interesting presentations looking at doing active self-correction and then doing imaging in active self-correction to see how much the alignment of the curve changes when you're in that active position. So what is active self-correction? For those of you who don't know, of course our clients know, but basically it is a method to get your curve in the most neutral alignment. So it involves a combination of shifting and also derotating. And it's really, I think each school of scoliosis exercise has some type of active self-correction, but really these research were done with the CS method, which is one that we use a lot. Because if you get into a good active self-correction, then you can exercise in that position and get even more benefit of your exercise. So they did 2 different studies. They looked at X-rays, active self-correction, and they looked at ultrasound. And ultrasound basically is another way that they can scan the spine without using radiation. So in both of those situations, being in an active self-correction actually helped to reduce the Cobb angle of the curves. It was a little harder to see changes in the rotation, but I think that might also be partly the measurements, right? Like the ultrasound is kind of hard to scan with the rotation, like especially if someone's slumping, it's kind of hard to scan. But that was very interesting to see that we can actually make changes on our x-rays and our alignment by being in that active correction. So we're getting more information that this actually works to keep us in a more neutral position when we see it on imaging, and that's confirming it as well. So those were the big takeaways from the second day. Then they give out the award, and then we came over here on the train to our new spot in Milan. We'll be in Milan for a week. So we're gonna catch up on some work. We're gonna go over to the Duomo and we'll catch up with you later.
What you doing?
We are here in Milan. We went to the Duomo. And around the Duomo, there's some really nice shopping areas. So we did some shopping, we did some good walking, which was nice. We brought Marlon with us. The Duomo is a building.
It's a church.
It's a church. It's a church, yes. We just saw from the outside. So it's a church, right? And then also we walked by the Castle Sforzesco. Sforzesco?
I don't know.
The Sforzesco. The name was the inspiration for the Sforzesco brace, which is what they use here in Italy for scoliosis treatment. I think that's one of the main braces that they use. So it was really interesting to see that in person. We also had a really nice dinner. We went out for burgers. There's a great burger place here called Bilis, and it's actually, the burgers are made with meat from Tuscany, and they're absolutely delicious. And it's not like so like filling and like as when you get a burger in the US. That's one of the things I love about being here is I have many issues with my stomach and, you know, other stuff, but I do really well here. Like the food is just fresher, delicious. There is actually research telling us that with people with scoliosis have more prevalence of functional gut disorders like irritable bowel syndrome, things like that. We think potentially the relationship might be through either hypermobility, anxiety, many of those things, but it is common for people with scoliosis to also have digestive type issues. So if you're someone struggling with that, it could actually be related to your scoliosis. Today, we are going to hang out with Michaela. So Michaela is our friend of ours that lives here in Italy. She lived in the States and now she moved back here to Italy. She's Italian native. She was born here and she is also our tattoo artist. So she's invited us, so we will get to see her little village where she lives and try out some really authentic food from that area. So we're really excited to make that trip.
We're filming the poop disposal. We're already going, we're rolling. Oh, it didn't say hallelujah this time.
It made a water sound.
Oh.
Meanwhile,
Are you recording me?
I've been recording the whole time.
Great. So Tuesday we kind of took it easy. We didn't really do too much that day, just relaxed, caught up on some work, enrolled some new clients into our coaching program, which is really excited to get started with them in our online program. And then Wednesday we went to get our tattoos. So our friend Michaela, our tattoo artist, lives here in Italy. So when we come, usually we'll get a few tattoos. I also got this piece as well from another artist in the Studio Marti. And this is actually my grandma Terranova's handwriting. This was like the last birthday card she wrote to me before she passed away. And as some of you know, I like to crochet, so I got a little yarn ball there from my grandma. And it's special to me because she actually lived in Italy for a period of time, so she was kind of the last one that had that connection with Italy. And she taught me to crochet. So as many of you know, that's one of my favorite things, one of my hobbies, things to do. Today we have to go back to the tattoo shop real quick just to get rebandaged up. And then we're just gonna putz around, do a little bit of shopping, exploring, kind of move around and see what we can find. You wanna be the star? You could sit here. Hey there, checking back in. Of course, every time we start the vlog, Marlon has to be in it. So he's put himself right in the middle here to be the center of attention for the vlog. Right, Mo? So yesterday, we didn't really do too much. I went to the gym and I felt really strong. And then I kind of figured out that the barbell I was using is 5 kilos less than what I usually use. So maybe I wasn't as strong as I thought, but I'm not 100% sure. We brought Travis' parents back towards the airport and they already are back home in New York. Today we did a lot of walking around. We went into like the Chinatown area of Milan, which is a lot of fun, especially for us because we love all things Japan, and they had some like Japanese stores there and different like types of Asian foods and things like that. And Marlon got to come with us, so that was a lot of fun. So we're pretty much wrapping up here. This is probably almost the end of our vlog. I hope that you enjoyed the content we shared from the conference. Of course, if you have any questions, leave them as a comment below. And if you like these vlogs and kind of seeing kind of how we spend life, how I spend my life with scoliosis, then go ahead and subscribe, leave us a like, or let us know what you want to see more of in the future. Marlon, you want to say bye?